14 and 18. My name is Emma Campisi, and I'm a kinesiology student from the University of Toronto. Today I'll be talking to you about the mechanisms of concussion injury and the 5 features of concussion that you should know. Involvement in competitive sports puts you at possibly the highest risk for sustaining a concussion, especially if you are involved in collision or contact sports. High school youth, such as yourselves, are at increased risk for brain damage due to your developing brains. The fact is, concussions are occurring. They can be debilitating and they can lead to negative health outcomes, and the numbers aren't going down. Studies have found that approximately 20% of adolescents will sustain a concussion within their lifetime. Concussions lead to approximately 2.5 million hospital admissions, emergency room visits, or deaths in the US annually. The purpose of today's video is to inform youth such as yourselves of the mechanisms of concussion and so that you can identify the 5 defining features of a concussive injury. These are especially important for you to know so that you can properly identify when a concussion has occurred to ensure for the proper management of this injury to allow for the best possible health outcomes. So what is a concussion? When a concussion has taken place due to a direct or indirect force transmitted to the head, the brain can shift and collide with the interior of the skull. This results in a functional injury. Now we can provide the definition of concussion. A concussion is a traumatic brain injury induced by biomechanical forces. It is a complex pathophysiological process, and it manifests by signs and symptoms. When a traumatic event occurs, which means that a physical injury of sudden onset has taken place, the brain tissue experiences stress and deformations. This leads to molecular alterations, neurotransmitter disturbances, synaptic perturbations, and structural changes. This creates an alteration in mental status and presents as a functional rather than a structural injury. One way you can identify if a concussion has occurred is by observing if a head impact has taken place and created a rapid translational or rotational movement. This very rapid mechanical loading on the brain can lead to injury. When these deformations have occurred, it is likely that a concussion has taken place, as exemplified in this video. Sports-related concussion is among the most complex injuries in sport medicine to diagnose, assess, and manage. It is important to have a clear understanding of what defines a concussion in order for you to be able to identify and then properly manage this injury and allow for an ideal recovery. Next, we will be discussing the 5 important features used to clinically define the nature of a concussive head injury. The first feature of a concussive injury is that concussion may be caused by a direct or indirect blow to the head, face, neck, or elsewhere on the body with an impulsive force transmitted to the head. For example, in a boxing match, a concussion can occur as a result of a direct blow to the head. Or, in the case of getting a car rear-ended, concussion can result due to an indirect force applied to the head in the case of whiplash. In sporting or motor accidents, injuries commonly result from impact to the head as a result of a high rate of acceleration or deceleration. Direct head contact is not a mandatory component of concussion. However, approximately 85% of concussions are the result of a direct head contact. The biomechanics of concussion involve the interrelationships between the forces expired during impact, between head and neck movements, and the deformation of structures at the macroscopic and microscopic levels. With concussion, the biological responses may be structural or functional, immediate or delayed. Next, we will be discussing the second feature of concussion. Concussion typically results in a rapid onset of short-lived impairment of neurological function. The injury resolves spontaneously in that there is no strong evidence to suggest that there are medications available for the treatment of concussion. Rather, healing just takes time. Concussion is an evolving injury, and signs and symptoms may evolve over a number of minutes to hours. Signs of concussion include loss of consciousness, balance issues, difficulty finding words, recalling, and memory issues. Physical symptoms include headache, nausea, and head and neck pain. Cognitive symptoms include feeling disorientated or dazed, difficulty concentrating, forgetfulness, feeling slowed down, or often in a fog. Sensory symptoms include light and sound sensitivity. Emotional symptoms can include feeling sadness, fatigue, or anxiety. In some cases, people just feel very tired and want to sleep, while in others, they may experience sleep deprivation. The third clinical feature of a concussive injury is that concussion may result in neuropathological changes, but acute clinical symptoms largely reflect a functional disturbance rather than a structural injury. As such, no abnormalities are seen on standard structural neural imaging such as CT scans, as indicated with these images here, or on an MRI. However, recent scientific studies have indicated that concussion can be detected using other neuroimaging, such as functional MRI, diffusion tensor imaging, magnetic resonance spectroscopy, or alterations in cerebral blood flow. The fourth important feature of concussion is that concussion may result in a range of clinical symptoms, as previously mentioned, which may or may not involve loss of consciousness. In fact, according to studies, loss of consciousness is only reported in approximately 10% of concussions. A study conducted by Omea and colleagues in the 1960s and 70s used animal models to understand the mechanism of whiplash and cerebral concussion, and they determined that the head needed to experience a combination of linear and rotational motion to produce a concussion which resulted in loss of consciousness. Although these findings are not completely applicable to human concussions, they do provide us some insight into loss of consciousness and concussion. However, it has been determined that loss of consciousness is not a factor associated with worse clinical outcomes. The fifth and final important feature of concussion is that resolution of the cognitive and clinical features typically follows a sequential course. However, in some cases, symptoms may be prolonged due to secondary issues. In high school youth, the average time to recovery is approximately 5 to 6 weeks. In fact, it is possible that if symptoms persist longer than this, you may require a multimodal clinical assessment to identify primary and secondary pathologies that are contributing to the persisting post-traumatic symptoms. However, the time to recovery depends on numerous factors, including initial symptom burden, amnesia, or pre-existing mental health issues. Appropriate management of concussion remains the best way to prevent prolonged recovery. In fact, approximately 5% of high school students will experience persisting symptoms following a concussion. Concussion accounts for approximately 9% of all high school athletic injuries. According to an 11-year prospective study conducted with American high school student athletes, concussion was found most commonly in men's football and women's soccer. The rates for concussion have increased with time as more people are educated about concussion and professionals have become more involved in monitoring concussive injuries in sport. Now that you have watched this video, you are able to identify when a concussion has occurred and you have obtained knowledge about the 5 important features used to clinically define the nature of a concussive head injury. So next time, when you're at a sports game, you will be able to identify this injury and thus assure that the management and care you or your teammates receive is appropriate for this condition to ensure for the best possible health outcomes for you and your developing brain.